From the time the government of Rwanda reinstated COVID-19 lockdown in the city of Kigali, public transport services such as buses and coasters and taxi motors have all been suspended. Yet, many of the medical staff who are already using public transport to and from work have no other alternative to get to their respective workplaces, which they say has made their work difficult.
On the first day of lockdown, it was difficult to get to work because public transport means have been suspended. Many staff stayed at home, which paralyzed medical services.
During lockdown, it is difficult to get to work if one is residing from a distant place. But the hospital has provided transport to pick people from Nyabugogo to get to work. But getting to Nyabugogo from Shyorongi is another problem. Now we depend on people with private cars who deal in essential services to drop us to Nyabugogo. Without their help, I cannot come to work. The director of Chibagabaga Hospital, Dr. Ngundibiza Samuel, says the issue became worse in the first 2 days of the lockdown, but authorities are trying to find possible solutions. The challenge has been shortage of cars, but cars have since been increased to transport staff members to work in real time. The Minister of State in the Ministry of Health, Dr. Munga Tasis, also says the issue of transporting health practitioners has already been addressed. The Ministry of Health has been working with different authorities, including the Kigali City Authority, to find timely solution. We've hired cars to transport medical practitioners, which will solve the issue during lockdown, while those with private cars have been facilitated to move, provided they present their work badges. On the other hand, some patients also want to be facilitated to get to medical facilities. These are some of the patients who said they traveled long distances during lockdown to get to Chibagabaga Hospital.
The challenge we face in moving in the middle of the night to get to the hospital. I left home at 4 a.m. and got here at 5:30 a.m. by foot. There are no taxi motors, no cars, and dispensaries will not even give you ambulance unless you are in critical condition. You have to walk. Due to the long distance one walks, by the time a patient gets here, they're already in a critical condition. It is a big challenge. We are likely to be transferred to Sehashka. Since I don't know the place, I would have used a taxi motor to get me there. But now that public transport means are not available to work, it is going to be a challenge.
On this issue, the Minister of State in the Ministry of Health, Dr. Munga Tasis, says in collaboration with local authorities, vehicles have been set up that will help those in need to get to and from various hospitals in Kigali, while those with private vehicles are allowed to use them for emergency reasons. The issue of patients is yet a big issue that we are concerned about. Up to now, those with private cars have been cleared to move to hospitals, but the challenge remains with those without private transport means. We've been asking cars and ambulances at referral hospitals to move to dispensaries to help those without vehicles. Medical services are some of the essential services that have been given priority to continue operating during COVID-19 lockdown in Kigali.